So basically, what is cardiac cycle? Cardiac cycle is defined as the sequence. Hello students, this is Dr. Ravi Sani. So today we are going to discuss about the cardiac cycles. So cardiac cycle is defined as a sequence of electrical and mechanical events occurring in heart during a single beat. So there are some electrical events and mechanical events. In case of electrical events, which is polarization and depolarization. But in case of mechanical events, we can call them contraction and relaxation. So these events occur in a cyclical manner in every beat, which is called cardiac cycle. The resulting changes could be in volume, pressure, and flow in different chambers, as we all know, the atria and ventricles. And the electrical activities that are recorded in the form of ECG are precisely repeated in each beat. Now come to the this phases of cardiac cycle. Basically, we have four phases: the atrial systole, atrial diastole, ventricular systole, and ventricular diastole. These are the various durations uh, of the phases of the cardiac cycle. In case of atrial systole, it is around 0.1 second, and the atrial diastole is 0.7 seconds. In case of ventricular diastole, it is around 0.5 seconds, and ventricular systole is around 0.3 seconds. Now come to the atrial systole. So basically, uh, in the atrial systole, blood enters from atria into the ventricle. But the important part is that almost 80% of ventricular filling occurs passively, and the remaining 20% portion could be categorized into the active filling of the ventricle. If any pathology is present in atria, then this will not hamper this normal filling of the heart, because 80% part is occurring through the passive filling. So if a person is having any kind of pathology, he or she can survive without any circulatory insufficiency. To meet the increased need for blood supply to the tissues during exercise, increased sympathetic activity boosts atrial pump activity and increases the contribution by atrial systole around 30 to 40%. So that remaining 20% filling could be increased in case of exercise. Various events which occurs in atrial systole are especially that the P wave and the and pressure also increases when there is an atrial contraction. The important point is that fourth heart sound, which is normally not audible in patients, I mean in subjects, but these can be traced by the specific instrument which is called phonocardiogram. The reason for the production of fourth heart sound is inrush of blood into the ventricles. There are some specific conditions like atrophy of atria or ventricle. When there is a stiffness of cardiac muscles in atria or ventricle, then they'll produce a sound. When blood will enter from the atria to ventricle, a sound is produced. This sound is called fourth heart sound, S4, which is always audible in pathological condition. Atrial diastole. Atrial diastole, basically it follows atrial systole. So atrial diastole occurs when, on the other hand, atrial systole is occurring. In atrial systole, there is a contraction of atria, Now come to the atrial diastole. So basically, atrial diastole follows atrial systole, during which atrial filling occurs. Atrial diastole occurs during ventricular systole. So these events occur simultaneously. अगर एक तरफ ventricular systole होता है तो उसी वक्त atrial diastole भी होता है. Now come to the ventricular systole. The phases of ventricular systole is divided into two parts. Basically, we have first one is the isovolumetric contraction and the phase of ejection. Now come to the phase of isovolumetric contraction. Ventricular volume the remains same throughout this phase. Therefore, this phase is called isovolumetric contraction. We are calling it isovolumetric contraction because इस phase में जो volume है, it is not changing. This phase starts from the peak of QRS complex in ECG. First, heart sound appears, which is due to the closing of the atrioventricular valves. Now come to the uh, ventricular volume does not change because closure of AV valve and aortic valves not opened yet. So basically, blood is not entering into the heart or not going outside from the heart. So the volume of blood is same. That's why this condition is called isovolumetric contraction. Phase of ventricular ejection, when the pressure is increasing due to the ventricular contraction, which will result into the opening of the aortic valves, which marks the onset of this phase of ejection. This phase is further divided into two parts. The first is the rapid ejection and the reduced ejection phase. During isovolumetric contraction phase, enough tension builds up in the ventricular wall. Therefore, with opening of aortic valve, aortic blood flow increases abruptly and the blood is ejected forcefully into the aorta from the ventricles. In isovolumetric contraction, the walls of aortic walls or the semilunar walls are not opened yet. That's why blood is not going outside from the heart, not entering into the heart. But in rapid ejection phase, when pressure is increasing continuously at the at some point of time, it will responsible for the opening of aortic valve, and finally blood will eject into the aorta from the left ventricle. The various important events in this phase are the opening of aortic valve. There is a steep increase in aortic blood flow, steep fall in ventricular volume, ventricular pressure increases further, which will responsible for the opening of the aortic valves. Now come to the this aortic pressure also increases but remains just below the ventricular pressure. The C wave correspond in the JVP curve. This phase corresponds to ST segment in the ECG. Reduced ejection phase. This is longer phase of ventricular systole during which both ventricle and the aortic pressure decreases. These are the various important events. Ventricular and aortic pressure decreases. Aortic blood flow also got decreased. Ventricular volume is decreased. Atrial pressure continues to increase slowly due to the blood returning to atria. The T wave in ECG appears in this phase. Now come to the ventricular diastole. It is divided into two phases. The first one is the isovolumetric relaxation in the phase of ventricular filling. The phase of isovolumetric relaxation, it starts because there is a steep fall in the left ventricular pressure. During this phase, no change occur in the ventricular volume as this period is placed between the closure of aortic valves and the opening of mitral valves. Therefore, this phase is known as isovolumetric relaxation. Because in case of ventricular diastole, there is a relaxation of ventricles. This relaxation uh, will result into the closing of aortic and pulmonary valves, but AV valves, mitral, the bicuspid and tricuspid valves are still uh, are not opened yet. That's why the volume is not changing. This condition is called isovolumetric relaxation phase. Various important events in which the most important part is the second heart sound appears, which is due to the closure of aortic valves or pulmonary valves. Atrial pressure continues to rise, and the peak of V wave of JVP appears towards the end of this phase of ventricular filling. This is the last phase, which is divided into rapid filling phase and the reduced filling phase. In rapid filling phase, it corresponds to the V wave in the JVP curve. Rapid increase in ventricular volume because ventricles are filling rapidly. A decrease in ventricular and atrial pressure. Third, heart sound appears as blood is rapidly rushing into the ventricles from the atria. Now come to the reduced filling phase, which is also called as diastasis. This is the phase of slow filling of the ventricle. Normally, the greater part of the ventricle filling occurs passively in both rapid and slow filling phase, and about 20% filling of the ventricles occurs actively. The 80% part is filled due to the passive filling.